They describe my specialty as walking in a minefield with clown shoes.
No,
Yes.
They describe your specialty as jack of all trades, master of none.
No, but that doesn't mean that I'm not good at what I do.
If you died today, you would be replaced in the hospital tomorrow. Your family can never replace you. Taking care of yourself and your family above all else, like they will figure it out at the hospital.
People don't understand that, like in the ER, and I know you on the trauma side too, but like in the ER, I may have just spent 15 minutes in a room telling somebody that we just diagnosed them with cancer.
Dr. Kendall and Dr. Bankhead, thank you so much for joining us on this episode of the Device Girls.
Yay, we're so excited.
We're so excited to have you. So Dr. Kendall and Dr. Bankhead are Aggie alums. So from Texas, relocated all the way to North Carolina. And so today we're just going to kind of deep dive into their journey and their experience of balancing a dual physician household with some pretty acute specialties. And so Dr. Kendall is an emergency medicine doctor and Dr. Bankhead is a trauma surgeon. And so we just go ahead and introduce yourself just a little bit.
Yeah. Me? Okay.
Yeah.
I'm Dr. Brian Kendall. I am an emergency medicine physician. My undergrad was at Texas A&M. That's where Brittany and I met. And then we both went to medical school at Ross University. I did my residency at UT Southwestern in Dallas. And then we've lived and worked all over since, currently here in Charleston. And and then we have do a bunch of stuff on the side. I'm a Substack author and do a lot about helping people get the healthcare that they need and avoid the emergency department.
Which is ironic.
Which is very ironic, yes.
You're going to put yourself out of a job, no?
Exactly. That would be my hope.
That would be the hope.
Yeah.
I love it.
So I'm Dr. Brittany Bankhead, and I guess first and foremost, I am a mom and a wife, and I think I try to make sure that like that is who I am, and then surgery is what I do. So what I do is I also went to Texas A&M, and I did a master's actually at Barry University in Miami, Florida. And then we went to medical school together. I did my residency in general surgery, and then I did a year of fellowship training. I graduated from residency at University of Texas at Austin, actually, and then did my critical care fellowship year in Boston at the Mass General Hospital Harvard program. And then my first job out of training was at Texas Tech.
Okay.
So I kind of always joke like I've hit all the major Texas
public universities.
institutions.
Yeah.
And then
She's kind of a big deal. If
I kind of dabble in everything like that.
Love that.
And then we recently moved here. I'm an associate professor of surgery and a trauma surgeon and an ICU doctor at the Medical University of South Carolina. And I also am an entrepreneur, both in our own podcast, which we have so much fun with and has been really fun to do as a couple. And then I also have a company called Modern Mom Lab, where I am trying to help give moms actionable ways to have it all.
Yes.
Yeah. And she has a couple of patents and stuff like that. So yeah, she's a big deal.
Literally doing it all. You guys are amazing.
Yeah.
So can we deep dive just a little bit into your journeys? Like, did you always know you wanted to be physicians?
Yeah.
Yes.
Yeah.
We did. We're like, I don't know if it's like quintessential or if it's
Cliche.
Yeah.
It's like super cliche that like
we were
both of us
five.
At
the age of 5. We
Okay.
both
yeah.
go.
There are pictures of like both of us with like playing doctor and whatever else.
Yeah.
Like
I had a I was such a nerd. Like I would ask for like heart pump models for my birthday and anatomy coloring books for Christmas.
Yeah.
You had all the same.
I had like medical images and stuff. I had like a brain image thing that I kept on my desk. Like, we were always just very, like when I was in middle school, like it was super weird. Yeah. So yeah, I always wanted to be doctors. Never knew what kind of doctors. I never knew what kind of doctor I wanted to be. I always thought I wanted to be like, I ran across something my mom had saved for me years and years ago. where I was like in elementary school or middle school, and I wrote that I wanted to be a pediatric neurosurgeon.
Oh,
that was apparently my dream.
Wow.
Yeah. And so I'm very far from that now. But the doc, I always wanted to be a doctor.
But it's funny. I wanted to be a family practice doctor.
Yeah.
Like I wanted to be a family doc. Yeah. And now I'm a trauma surgeon, and that couldn't be more different. So I think we both knew we wanted to do medicine for sure.
That's amazing.
So why trauma surgery and why ER?
Oh, so ER for me, I didn't even know ER existed. All up through like my second year of medical school. Like I was a head anatomy TA, and I was doing all the things like going to surgery. And then Brittany had a friend. We went to Houston for some reason, and Brittany had a friend, I guess like one of your old roommates, right? From A&M, who was in residency at the Baylor College of Medicine there in Houston. And she set it up to where I got to go shadow her for just like half of a day.
Yeah.
Awesome.
And I went, and it was nuts because it was at Ben Taub Hospital, and like we went from one bed with like this really sick patient in an clear isolation tent. And there was like this huge room, and there was another bed with a totally different sick patient, but still very sick. And then the same thing. And it was that moment. I was like, this is what I want to do. This is super cool.
That's amazing.
Yeah. For me, I mean, again, I thought I wanted to do medicine, but as we kept going through medical school, I was like, ooh, I actually love working with my hands, and I like doing technical things. And then it's so ridiculous now, but I thought that surgeons were just like technical monkeys, and they didn't actually know anything. They just knew how to do things. And I was like, well, I don't want to be a dum-dum. Like I want to like actually know stuff. Like I went to medical school. I don't want to just like lose it all. And then, which is so silly now, but then my MS 3 year, I guess, it was like, I did my surgery rotation. I was like, oh, shoot, like these people are smart, actually. And like all you get to see is that's all you know about them is the operative stuff. But oh, man, do they know so much. And so my respect was definitely gained then. And I was like, okay, I think I want to do this. And then especially realizing that as I got further into my surgical training, that you could combine like trauma surgery and acute care surgery where you do something different literally every day, and critical care where I could work in an ICU and be trained in like the most complex of multidisciplinary and multi-organ system care. Like that was icing on the cake for me. And it encompassed everything I wanted to do. And it had a lifestyle that could afford me the ability to be the kind of mom and human that I wanted to be too. So that was a really good fit for me. And I think you would say the ER.
Oh yeah. That was a huge draw for me, was the lifestyle, like shift work, so that, you can have some days off during the week, and, your full time is usually like 14 or 15 shifts a month. So it's been really good.
So can we talk a little bit about that? Do you guys try to like match your schedules, or are you very like, you get to see each other mostly in the hospital, or how do you guys juggle this?
It's changed a lot through the years. We were never in training together in the same hospital. When I first finished fellowship and we lived in Lubbock, that was the only time we've ever worked in the same hospital the whole time, which is ironic because we were divorced for half the time. So we, like, in case any of your listeners don't know, like we were married and then we got divorced for 2 years, then we got remarried.
Yeah. No plans. Like we never thought we would ever get married.
So half that time we were divorced and having to work together, which was even funner. But we now, even then, now we never try to match our schedules. It's just impossible. We really put our kids.
The biggest thing that we do is like, we know her schedule way more in advance than we know my schedule. So I always request off to make sure that we're never on the same night shift, so that our kids always have somebody here at night.
We don't have family that lives here. And then we, if the kids have something coming up or a party or something, we really prioritize their needs above ours. And then we just kind of let the cards lie where they may. And I think that's one thing, like mentality wise, that I've learned, and we've probably learned over time, is you can find the good or the bad in anything. And so when we both have time off together, we find the good in that in trying to do things together and have date days. When one of us is working and the other is off, we try to find the good in, okay, I get a little me time, or okay, well, I'll try to get all these things done since I can't be with you anyway.
Or I have an evening by myself with the kids. Like, what can we,
So finding the good, whatever that means.
I love that.
I love that.
Love that.
So you guys kind of touched on this a little bit, but I'm interested to know, like, how did you guys rekindle your marriage and everything after being divorced for 2 years?
Fun. Fun segue.
Yeah, it was interesting. So, we got divorced. Like, it was like, we were really good co-parents. We really, continued to co-parent really well together. But during that time, we really did our own kind of journeys, like really worked on ourselves and tried to figure out kind of who we were. And at the end of that, and then 2 years ish later, we were sitting at the community pool where, in this neighborhood that we had both bought houses in on separate sides. We were watching our kids swim. And it just kind of all of a sudden looked across the pool at each other and was like, wait a second, you're who I've been looking for. And then kind of vice versa. And it just kind of clicked. It was crazy.
Yeah.
I never expected, never something that was I'm going to, this is the goal to get remarried at some point. That was never the plan, but very happy that it did.
Yeah.
Yeah.
I love that. I truly feel as though we've just really enjoyed learning about you guys and following your journey a little bit. And I feel like you've really kind of humanized medicine and physicians, for just kind of the everyday people as well. You guys are people as well who go through some of the same things that, people who are not in the medical field. And so I absolutely love that.
I do too.
Thank you for saying that. That reminds me of the old, I don't know, maybe I don't read magazines anymore, but it reminds me of all the celebrity magazines in the past where they would be celebrities, they're just like us. They go to the grocery store. They fall asleep on a park bench or whatever.
Yeah.
But it's so true. You're so right that there is, I feel like there's in today's culture and society, physicians are so dichotomized. I always talk about dichotomy, but it's such a dichotomy of either this physicians are one step under God, and that's how it used to be, which is not healthy. And then, or it's all the way to the other side of what do they know? They just want to push a pill or do something for their own pocketbook or something. And it's there's no trust anywhere in the middle that we're humans, but we also worked our butts off and gave up our life for decades in order to build a wealth of knowledge and experience and technical expertise in order to help you. And that counts for something too. But also I'm a human and I'm exhausted and I'm trying to also live life with our family. And so yes, I'm glad that's your perception, because that is important to us.
I love it.
We were talking about this with somebody else, just about how people don't realize what you guys go through every single day. And they can walk into a doctor's office and be, pissed off because you only spent 10 minutes with them. But it's you don't know what else they're dealing with too. Like you said, you guys are humans. And I think that is such a big thing that people need to understand, that from a patient side too, and bringing up the trust factor. So do you guys deal with that often, and how do you kind of navigate that with patients?
We talk about this. Yeah, we talk about this a lot on our social media and our podcast stuff too, but yes, all the time. People don't understand in the ER, and I know you on the trauma side too, but in the ER, I may have just spent 15 minutes in a room telling somebody that we just diagnosed them with cancer, and trying to comfort them and reassure them and give them all the information that they need, and try to make sure that they're set up with everything that they need. And then coming into the next room of somebody who's there for some cough and cold symptoms, and they're mad because they've waited 30 minutes to see a doctor, and they just and it's I can't tell them why I was late. I can't sit there and say well, you had to wait so long because I just delivered a baby, or I just had to do chest compressions on somebody, or I can't say any of that because it violates federal law. So I just have to kind of sit there and take it and say, I'm sorry. I got in here as soon as I could. And so, yeah, in those moments, it's like, when you're waiting in an ER, that's usually a good sign. It usually means that, number one, that like everything that we've seen so far with your vital signs and your initial concerns and all that is like, it's going to be okay. It's usually not a bad thing if you're having to wait a little bit. And typically it means you should be grateful, because that probably means that there is somebody way sicker than you that is currently getting the attention.
The biggest time I saw this was, it was the middle of the day, actually. And I was supposed to be staffing our trauma clinic in the afternoon. And I had a trauma patient come in, and it was probably the worst traumatic injury you can imagine. And there were 3 or 4 different attending surgeons operating on this patient who ultimately died. And it was, for a lot of reasons, it was it's always hard to lose a patient, but for other reasons, this one was especially hard. And I scrubbed out and called time of death, and I get a page from the clinic that people are pissed and they're mad because clinic started 20 minutes ago, and where are you? And I'm like, I need a minute. And I mean, when you talk about things like burnout and moral distress that doctors will suffer from, it is moments like that where it's like, I can't even process what just happened here, much less walk into a clinic and greet you with a smile and safely treat you. So I need a minute, which I've gotten better at over the years of drawing some of that firm boundary. But, in the same way, like we're humans too. Yeah. We're parents, we're busy, working people. And we understand some people may have driven 2 hours to be at that clinic, or they may have taken off work specifically to be there. And I get it. And so I think just having a little bit of humanity and knowing, my favorite thing right now is remembering everybody's doing their best. Yeah. Like no one in life is like trying to be a jerk or whatever. So just that element of humanity. I went to a clinic the other day. They were 2 hours behind, and I'm like, well, that super duper sucks because I can't wait for 2 hours. But I'm not going to go leave a mean Google review. I'm not going to tell the staff they can stick it where the sun doesn't shine. I'm just going to say I can't stay. I'll have to reschedule, and like that's it.
Yeah, yeah, that's a great point.
Absolutely. How do you feel as though you kind of separate? Like you talk about, those experiences, how do you then like remove yourself and just kind of like center yourself to get your head back in the game, whether that's to go see the next patient or to come home and see your family and just, give them 150% to like you guys are doing on the job?
I think that's where having good work-life balance and being well-rounded really comes into play, because it's in the moment, it's really hard, right? But when you are taking care of yourself and you're taking care of your mental health and doing things like exercising and getting good sleep and doing things outside of work, hobbies, and being able to, spending quality time with your loved ones and your family, those moments don't have quite the amount of impact that they would if you were in a really bad headspace. I think the other thing too, and what's so helpful, is that Brittany knows exactly what I am going through, and I know exactly what she is going through. It's very nice to be able to come home and be able to discuss healthcare things with somebody who truly understands as they're in it. And that helps me immensely.
It does. I think I learned through, I was in residency for 6 years and then fellowship for 1. So like a total of 7 years of training. And I think that time also taught me how to, because you have to suppress a lot while you're at work. You just have to, and you couldn't function if you felt all the feelings all the time. And so that time does teach you how to learn how to suppress, to be able to safely and effectively keep moving through your shift. But what I've also learned is you have to balance that with ooh, for whatever reason, this patient really got to me and this scenario really hurt me. So I am going to, again, take a moment. I'm going to walk outside. I'm going to bawl my eyes out, and then I'm going to wrap it up, and I'm going to walk back inside, and we're going to keep going until I can debrief with my therapist later. Because I allow myself, I don't allow myself to feel all the feelings because it's not the time. But I do, when it really hits me, I let it flow. And that is, that's something I learned after COVID, actually, with the PTSD I had around COVID, to sometimes let it flow if you need to in a quiet and like private space, and then come back. And that has helped me too.
Yeah.
I'm curious because you brought this up. What, from a physician standpoint, what was COVID like for you guys?
Oh my gosh. So fun fact, not a fun fact, like sad fact. I mean, this was 6 years ago now. I actually cried today. I was at the hairdresser, like at the hairstylist, and I'm scrolling through my phone, old photos, old videos. I came across a video I was in this like international collaborative. We were all sharing research about COVID and, helping one another, people from Italy, from China, from literally all over the world. Wow. And someone had sent a video to this text thread, this international text thread, the very first time, hopefully I don't get emotional, of some Chinese officials walking over outside under this awning to some Italian healthcare workers with their Chinese flags and their boxes of N95s, bringing them like just a few boxes. Like 2 or 3. It was like 3 boxes of N95s because the Italians were totally out and the Chinese had a few extra to give. And they're like, teary-eyed. And I cried again, remembering what being in the hospital during this time was unlike anything I will ever experience again in my life. Yeah. The amount of hopelessness and helplessness and exhaustion and fear, like major fear every day. And on top of all that, not knowing how to clinically treat what it was that was happening. Like we had no idea. All the stuff we know now is because we learned, oh, wait, art lines are clotting. That's really weird. Oh, well, it turns out COVID can cause clotting problems, but like we didn't know, you just didn't know. And so that made you also feel like a crappy doctor. It was awful.
Not to mention that we are in Boston with no family. It was just us and our 2 kids. And Brittany and I had to go to work. At the time, that's when we were wearing basically like spacesuits. Anytime somebody came in with COVID, we didn't know, like if something happened to Brittany and I, we had nobody there to care for our children. So we actually flew our children at the very beginning of it all, flew them to Texas, and they stayed with Brittany's parents for 72 days. I think our son kept count. 72 days in Texas while Brittany and I stayed in Boston, continuing to care for patients. And it affected our children too. Like our son, our daughter doesn't remember all that much, but our son still remembers it. And I mean, we both still struggle with, the after effects, the mental kind of after effects of what happened during COVID.
I mean, I had wrote down every password, where our will was and all that. I had taped it to our front door so that my parent, like if we died, then my parents wouldn't have to come in the house because we would have had COVID and I wouldn't want them to, all of it. Like it was awful.
I'm so sorry. Well, thank you and your family for what you guys did for everybody during that time. We really appreciate that.
Thank you.
How do you feel as though that experience has kind of shaped how you approach medicine and are as a physician today?
Oh my gosh.
Yeah.
On a like humanity level, I think that was really, people made it not a medical thing, but a political thing. And so all of a sudden now, like we're getting, these things about misinformation and, COVID isn't real and all this stuff. And it's like, are you insane? Are you like, what are you talking about? Not real. How is that even? And so the shift in patient trust, I think, affects us forever after that whole thing, which is, medicine and surgery are already hard. It's just made it a lot harder, which is frustrating. On a personal level, I think, the PTSD that I had from it definitely shaped me moving forward. And I think I've had to learn from that, which I don't think is a bad thing. But yeah, it will. Yeah. I still have triggers that I have to breathe through and get through. And yeah,
I do too. I think that another thing that it taught me was just you have to be really careful with your words, and especially when you're in a position of some sort of leadership or power. And because at the beginning of it all, there were government officials saying things like, masks won't help you. Don't wear masks. And then all of a sudden, a few weeks or months later, they're like, everybody needs to wear a mask. And it really set us all up for some form of failure, because it's one of the worst things you can do in any kind of science or medical field is speak in absolutes and saying like, you should never do this, you should never do that, you should always do this, always do that.
And apologizing when you were wrong.
And
acknowledging when you were
wrong.
Thought this, it's not like, just say it. Like, I'm sorry, and this was the wrong info, and own it.
Because there are so many things that we don't know, and everybody was just trying to do their best and try to keep people healthy as much as possible. And so instead of being like a team effort, it became this like, he said, she said, and a bunch of like, well, they said this before and now they're not saying this, so this all must be made up. It just really it did a disservice to everybody in the medical community. And so I'm really careful now with my words when I'm giving medical advice. I'm always very careful to say like, listen, this is probably it, but there's always room for outliers,
which is again why he specifically started the platform he did on social media and Substack and all these things, because it is hard to know what sources are good and what's politically charged and financially charged, and
just trying to put truth out there of what actually is happening.
So since we're on that topic, why don't we talk through both of y'all's kind of side gigs here a little bit, because also I want to know, like, you're like, we're both physicians, we have a family, let's just take on entrepreneurship too. So how did this happen?
So we have several different business ventures. We have a property company where we have a couple of long-term rentals and a short-term rental that we have as kind of like investment properties. And then we've got our podcast that we do, which is called Coffee Walk MD. And it stems from us when we got remarried, wanting to make sure that we had the best communication possible. And Brittany had a really good friend who she and her husband went on these things where they took coffee and they walked, and she was like, it just kind of helps with our talk. Like, we just kind of talk and it's really good. So we're like, well, let's try that out. And we have been doing it now for years.
I love it.
And we have had some of our best conversations on these simple kind of coffee walks. And so we wanted to bring that to as many people as possible. So that's why we started the podcast, and it kind of gives a framework for how people can do a coffee walk and what kind of topics they can be talking about. And then on social media, both on Instagram and TikTok, and then on Substack, my mission is helping people avoid the emergency department by putting out everything I can think of like kind of using real life scenarios that have happened. I've seen patients struggle with in the emergency department, and trying to put this out for, as public knowledge of, hey, just so you know, when you have high blood pressure, these are the reasons why you should come to the emergency department, and these are reasons maybe you shouldn't come.
Save the time, save the money, save the headache.
Save the headache,
like, for this one, or for this one, go to the urgent care. For this one, go to the emergency room, and trying to help people, because it all kind of stems from like, his sister, his brother, my family, like we can call him and say, hey, what should I do? And he's like, I just wish I could do that for everybody.
Yeah.
And so that's really where it stems from, is trying to give people that insight that he gives everyone else.
Mm-hmm.
And then I own a company called Better Bleeding Control, which is a medical device technology that I've invented. It is intended for military use. It's a biofeedback hemorrhage control trainer, and I'm hoping to help save more military lives and limbs by teaching them better ways to apply this tourniquet. That's what the patent is for. And then Modern Mom Lab is my warm hug to motherhood and the world. And I am trying so very hard to help find actionable ways to help modern motherhood. And currently that means for the stay-at-home mom who's looking for a side gig and is super organized and runs her family really well, but needs a little extra income, teaching her how to take those skills and become a family virtual assistant to help other moms and families with something she's already awesome at. And then helping these like busy career women and moms who have lots going on and would love to spend more time with their families, but just don't quite have enough hours in the day. Showing them that, hey, you could take a family virtual assistant and have them help you with all of these, tedious administrative things, and that will free up your time to do lots of other things. And then the last kind of platform I have there is for something I call Time Alchemy, which is really just in Facebook groups over and over and over again. I see these new moms and they're like, I know I need to outsource, but I don't know how. Or what, and it's kind of a crapshoot on what kind of comments you're going to get on the help that you're going to get. And so this was really created to help be the gold standard for that, on how to get back 10 hours a week through all the different types of outsourcing, and walking you through that and giving you everything you could possibly need to do it by yourself, and kind of holding your hand through it. So that is our
That's amazing.
Right.
So at this point, have your kids expressed any interest in medicine or entrepreneurship? I mean, they see you guys do it all.
No. Our son wants to be a sports broadcaster, and we're like, awesome, dude. Great. And then our daughter wants to be an artist, and we're like, great.
Oh, love it. That's amazing. That's amazing. Well,
you guys are incredible.
Yes.
Thank you for all that you do. And I love that you guys have taken on these, side businesses, and you're trying to help out in other ways than you already do so incredibly for humans in general, saving lives. So we appreciate you guys.
And we love those segments online of emergency medicine or ER or trauma surgeons. So we have to do one before we close. So let's see.
All right.
Okay.
We're like settling.
Get ready.
Who does it better? Okay.
Got to get the boxing gloves on. All right.
Okay. So gunshot wounds.
Ooh. Oh. Where is the gunshot wound?
Does it matter?
Yes, it matters. It totally matters. Because if there's a gunshot wound to an extremity, you want nothing to do with it.
Okay.
That might be true.
That's very true. And I have to deal with it.
Unless you've lost a pulse.
Unless you've lost a pulse, But gunshot, I don't know how many times I've heard the trauma surgeon be like, no, it's fine. Y'all just handle it. Okay, great. We got it.
Yeah. If it has a tourniquet up, or if it's a thoracoabdominal or pelvic wound, or a head wound, it's always going to be mine. Anything to the extremities without a tourniquet, you can have.
Okay.
He would do better.
Okay.
I don't know that you would do better, but you can have.
I would definitely do better, because you never do them. And I would agree. Anything to the box would be yours.
More than the box. But okay.
That's so funny. Okay. Car wrecks.
Ooh.
Me.
Yeah.
Every time.
Not every. How many? I see way more car wrecks than you do.
But just because you see more doesn't mean you do them better.
I do them better, though.
No, you.
Yeah, because you don't want anything to do with them. There's not like an injury that needs to be fixed. Once again,
you're probably more empathetic.
I am. Yeah.
Okay. Actually.
Yeah. So I think we both probably do car wrecks really well. Again, I will say that if there is a severe traumatic injury from a car wreck, I'm very glad to hand them off to Brittany.
Yeah.
Or even a moderately traumatic injury.
I do lots of things. I do lots of things for moderate traumatic injuries.
So funny. Okay, handling complete chaos.
Oh, me for sure.
Oh, come on.
I handle complete chaos all the time.
Really?
Yes.
Define chaos.
Chaos is like you've got EKGs being thrown in your face while you've got a patient that's coding, while you have two more EMS trucks come in, one with like an anaphylactic reaction and another one with a heart attack. What?
They're all in the emergency room, like this cute little chaotic center, whereas my chaos is throughout the hospital.
Oh my word. Your
There's
chaos
fires everywhere.
Your chaos is in hospital beds with people on monitor them and all that. My chaos is in chairs with nobody on a monitor. And plus, your chaos is defined chaos. You know what they're sick from. I have people coming in all the time. It's the undifferentiated patient. You love that term.
Oh, man. Wow, y'all make some good arguments on these.
I love it.
That is so funny. Okay.
Okay, last question, because I love this one. Who secretly thinks their specialty is harder?
Oh, me for sure.
It's not a secret with you. You definitely think your specialty is harder.
100% for a lot of different reasons.
My specialty, they describe my specialty as walking in a minefield with clown shoes.
No,
yes.
They describe your specialty as jack of all trades, master of none.
No, but that doesn't mean that I'm not good at what I do. I'm a master of being a jack at all trades.
Oh.
Yeah. See how it works? Yeah. So I'm very good at what I do.
What's amazing is I can do everything you can do, and I can do other things.
No.
Like Annie gets your gun.
You can't do everything I can do.
Like anything you can do, I can do better.
No, anything that you can do, I can do better. I can do anything better than you.
No, you can't.
Yes, I can.
Well, I absolutely love it. Thank you all so much. Do you have any piece of advice for anybody who is dual physician household or looking to get into medicine or like big dreams of doing it all? What would that be?
Yeah. So I'd say for people, there's a lot of people in medical school who are married or partnered and they're going into, residency together and doing the couples match. Just know that that's a really stressful time and that you can get through it, and that make sure that you are putting down every single option that you possibly can when it comes to the couples match, and that it will be okay. That no matter what, you will get through whatever scenario you end up in, as long as you work together and have each other's goals and dreams in mind.
Totally. And I would say I love my job and I love what I do, and I can't imagine having done anything else. But I also learned very quickly that old adage of like, if you died today, you would be replaced in the hospisil tomorrow. Yeah. And your family can never replace you. Mm-hmm. And so remembering that you like taking care of yourself and your family above all else, like they will figure it out at the hospital, but like your family can't figure it out without you. So keeping your priorities with that in check is so important just from the very beginning.
Yeah, well said.
Yeah, I love that.
Absolutely.
Well, Dr. Kendall and Dr. Bankhead, thank you so much for what all you do for patients. And thank you so much for taking the time as well to come on today.
Thank you guys.
Yeah.
So
Thanks
much
for
fun.
having
Thank
us.
you.
That was really fun at the end too.
Yes.
So
fun.
That was the first time we've
done that with anybody else so far.
Really?
Yeah.
Okay.
Awesome.
Good deal.
Yeah. I'm so glad we did it.
Yes.
Yeah.
Like
awesome.
popped our do that with other people.
There we go. What a good deal. Well, you guys having a wonderful rest of your day.
Thank you.
Thanks. Bye.